I do wish that the state and the managed care plans had reached out earlier to the partner CBOs to really help them understand what the Calian program was, how that impacted the clients that they served, and how to bring them into the Medi-Cal billing world, which is so different than grants or donations or philanthropic opportunities that a lot of CBOs work with. I do believe in general, everybody underestimated the work that was required to get our non-Medi-Cal billing partners into the space to become Medi-Cal billing.
If I could go back in time and change the program, I would have money available right out of the gate for anyone who's signing a Calian contract. There needs to be infrastructure funding and training right off the bat. And that could be hiring new staff, doing HIPAA compliance training, building out a CRM, finding other providers to work with. There's so much need for infrastructure for organizations to get started, and in particular for nonprofits. There are for-profit national corporations with lots of VC funding who are going around looking for these contracts. And if nonprofits in the local community are not able to step up and build the infrastructure to compete, then we are all going to be blown out of the water by Amazon.com. And for us, we want to support the health of the community members and the Medicaid members we're serving, but we also want to make sure that California agriculture is thriving and the California economy is thriving. And for that, MCPs really need to reach out and partner with nonprofits and businesses in the local community and make sure that those organizations have the resources they need to build a sustainable Medicaid program.
I think if I had unlimited resources, unlimited power, and I had the power in the state to actually make an implementation change for Calian, probably number one I would do is really push at the state level for a set rate and negotiated rate for implementing Calian services. So a set rate for enhanced care management and community supports. This would alleviate many challenges that we've had here, and we've heard from community-based partners in trying to negotiate for services and contracts with managed care around the new social component. And then I would also take all of our lessons learned from our Medicaid and previous waiver pilots and consider how those could be implemented with the new service delivery system. Instead, we got to like year 2 or 3 and we said, well, let's go back to what our lessons learned were and come back and apply them again.